Welcome everyone. Tonight's session is going to be about first aid. We're going to hear from Emily Leung of the University of Texas at Dallas, Emergency Medical Response. Today we're going to hear about first aid basics and how to keep our loved ones and family safe and secure. Our session tonight is an initiative from the group HRI Connect, which is a group of immigrants and refugees in DFW working together to build a community that works better for everyone. Our group envisions a DFW where everyone feels welcome and embraced, regardless of what we look like, what language we speak, or where we are born. We meet once a month to share our experiences, to make plans, and to strategize. If you're interested in joining us, please send us a message in the chat and we'll share the details of our next meeting. One of our HRI Connect's priorities is making healthcare more affordable and accessible for everyone, regardless of immigration status. Now, this session is a part of a series of sessions planned for the rest of the year. Our goal is to get trustworthy information and keep ourselves healthy and give information about keeping ourselves healthy to everyone who needs it in the languages that we need. As you all know, that we are a group of diverse people from different parts of the world.
Welcome back, everyone. We are so thrilled to welcome Emily today. So at this point, we'll turn it over to Emily.
Hello, hi everyone. My name's Emily. I am an EMT at the University of Texas at Dallas with the program UEMR, University Emergency Medical Response. UEMR just started about 4 years ago. But we have really expanded in that time. Now we do multiple classes throughout the year. We also train firefighters who are looking to get certified throughout the year as well. I believe we've trained over 30 fire stations at this point. So I'll just wait for Callie to pull up the slides. But today we're going to be talking about CPR, bleeding emergencies, and choking emergencies. Okay, so the first topic we're going to be talking about today is CPR, also referred to as cardiopulmonary. Also referred to as cardiopulmonary resuscitation. You can go to the next slide now, Callie. Thank you. So in CPR, this is when what we do in CPR when someone's heart stops beating. So the first step to CPR is safety. You have to determine your own safety before you start trying CPR. So you have to assess, is the scene safe? Are there any dangerous objects around, people around? You cannot help someone if you are injured. So just like how on an airplane, you put your mask on first before you put on your child's mask, this is also the case with CPR. And the next slide, please. Can we go to the next slide, please, Kelly? Sorry. Okay. Okay. So after you have assessed if the scene is safe. Step 1 is if the person is unconscious, shake them pretty hard too, and ask them, are you okay? You're trying to elicit any response, see if they're still conscious, they're still there. If not, they'll be fully, they just won't respond at all. You can also feel on their neck here, just on one side, to see if you can feel their pulse. You want to feel on their neck because that's one of their main pulse points. And if you can't feel a pulse, that's your sign to start CPR. So if they're unconscious, not responding when you shake them and ask if they're okay, and you can't feel a pulse, that's when you should start CPR. Step 2 is before you even start, call 911, or even better, ask someone else to call 911. So you want to direct someone else, hey, please go call 911 while you start CPR, or you call 911 while someone else starts CPR. That's the most important thing that you can do for them, is to get the emergency responders there as quick as possible. And step 3 is, if you have no response, begin compressions. So, and I will demonstrate this in just a moment, but begin compressions and ask someone else to get an AED if an AED is available. So for those of you who don't know what an AED is, I have one right here. I don't know if you can see my screen. I'll show it again later. And there's AEDs all around. Typically in public places, every public place should have an AED around, just in case of emergencies. So you can ask someone to get the AED for you. If you're at a store, ask a worker. If you're at a public library, ask a worker as well, things like that. And I'll demonstrate what an AED does later. Step 4 is continue compressions until emergency response arrives. So the most important thing and the best way to ensure someone's survival after a heart attack is to continue doing chest compressions. So that's the best way to ensure their survival. If the chest compressions start almost immediately after they fall unconscious, until the time that emergency response can take over, because those can be a critical 5 to 10 minutes where their brain is not receiving blood flow and their whole body isn't receiving blood flow. Okay, and do we go to the next slide, Callie? Thank you. Okay, so the rate at which you do these chest compressions should be 100 to 120 beats per minute. I don't know how many of you have seen the infamous scene from The Office where they sing "Staying Alive" in order to do this, but those are just helpful ways to keep track of this tempo. You can sing "Staying Alive." You can also sing "Baby Shark." I believe that's the most viewed video on YouTube right now. So if you know Baby Shark, then you can sing that in your head to try to keep that rhythm. Okay, and we can go to the next slide. Okay, and the depth at which you want to compress the chest, and I will demonstrate all these in just a moment, is 2 inches. 2 inches is pretty deep. While you're doing chest compressions, it is deep enough to the point where their ribs may break. And
arriver que les os peuvent se casser. y hasta
it can be fairly traumatic, but in order to ensure their survival, that's the depth that we need to go to. And they can always heal from a rib break, but you know, they can't heal necessarily if we don't do CPR on them when they need it. And we can go to the next slide. And there's actually different depths that you need to hit for different age groups. So for adults and children, you want to hit that 2 inches. But for infants, so we classify infants as children who are under 1 year old, you want to do 1.5 inches. And there's a special way to do infant CPR. Okay, and can we go to the next slide, please? Okay, so for infant CPR, there's a couple things we can do. So instead of shaking them and asking, are you okay? What you really want to do is tap their foot to check their response and call their name. If they're not responsive, we want to do the same depth, which is same rate, 100 to 120 beats per minute, or the beat of Staying Alive or Baby Shark, and 1.5 inches of depth. So if we go to the next slide, I think we can stop sharing and I can demonstrate if everyone can see my camera. Okay, so I'll start with the infant CPR. We actually have a baby dummy here, which we use to train with. And how this works is, here's the baby. How you want to do it for infant CPR is your hands can either be wrapped around their chest like this, so you're holding them steady. And obviously you want this to be, let me see, sorry, there we go. You want this to be on a flat surface, ideally. So you can wrap your hands around like this. This is more comfortable for people. I think it feels a lot more stable. And you want to just press down at a rate of 1.5 inches, or at a rate of 100 to 120 beats per minute, 1.5 inches, if you can see on my screen. You can also use 2 fingers and press down like this. And where you want to be pressing down is really around this chest bone area, like right under the nipple line there. So that's where you want to be pressing down. And I don't know if you guys can hear the clicking that it makes when I go at the correct depth. So that's for infant CPR. Again, you want to tap their foot and call their name to check their response. Here's the AED that I mentioned earlier. These are all around in all public places. It is a requirement for places to carry these. So you can call anybody to find an AED.
سامانی که دسته خانم می باشه باید به شکل درست.
And there are adult pads. So you can choose accordingly. And the actual AED will have a diagram to show you where to put the pads. Now, let's just assume that these are infant pads. You want to put 1 pad on their chest, and then you want to do another pad, on their back like this. So it would look like this. After you put the pads on, you just connect it to the AED, and you just press this start button. And there you go.
Analyzing heart rhythm.
So the AED.
Do not touch the patient.
So once it says do not touch the patient, you don't touch the patient.
Doc, Advise.
And if there's a stock that's advised,
Target.
it will charge and
Stay
let
clear of patient. Deliver stock now.
and
Press the orange button now.
it'll let you know when to press the orange
Stock
button.
delivered.
So all AEDs will tell you exactly what to do. You just need to follow the directions that it gives you. Okay.
Emily, would you be able
Yeah.
to tell us where would we expect to find an AED, and when we might look, or where we might look for one?
Yeah. So you actually should be able to find them in all public places. That includes restaurants, stores, most chains. You should also find them in public libraries, schools, universities, places like that. It's a requirement to have them around. And usually you don't notice them right away because when you're going to a store, you're just looking at the clothes or you're going to order food, but they are mounted on the wall with a large.
مثلا شما به رستوران میرین یا به
Mais vous allez voir qu'il y aura
Es que
So
dicen AED con una luz.
at those locations and you'll be able to find one. So while the AED is actually on the person, you can continue chest compressions and you should continue chest compressions until it tells you to stay clear of the patient if they advise a shock. And then once you stop the patient, go straight back to chest compressions. But the most important thing is to continue chest compressions throughout the whole time. Now I'll move on to the adult mannequin here. And then I'm going to swing around. Let's see. AED, yes, that is exactly how it is called. Okay. So for adults, and I think I won't be able to see questions in the chat from back here. So if someone wants to unmute and let me know, that would be great. So for an adult mannequin, again, you want to shake the person, ask their name. And what you want to do is position your hand, one hand flat on their chest here, and the other hand is going to go on top like this, like that. And then you want this person, let's say that they fall unconscious while they're sitting down. You want to move them to a flat, hard surface, preferably one that you can lean on. So I don't know if you are all able to see, but this table height for me here is a little bit inconvenient because I'm not really able to stand and lean my body weight on. Because while you're doing compressions, you don't want to be actually moving your arm like this. This is too much work. You're going to get tired really easily. You already get tired doing compressions either way. What you really want to be doing is, let me stand on my tippy toes to demonstrate. What you really want to be doing is leaning down like this and putting your body weight on them. So you don't actually want to be pressing down like this. You want to be just leaning your weight down and moving like that. And I don't know if you guys can see, this mannequin lights up when the blood flow is going through the body. Yes. And that again is at a rate of 100 to 120 beats per minute. And it's going to be continuous. If you get tired, switch off with someone else who knows how to do chest compressions, because when you're doing chest compressions, you're going to get tired very quickly.
Emily, question for you. You said that the amount of beats per minute, you could do it with a song. Could you show us how that would work?
Yes, I can. Please excuse my singing. Okay, So I'll just take Baby Shark, for example, because I think that's really popular. So just be like, in my head, obviously, I'll be singing, Baby Shark, doo 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 doo, Baby Shark, doo 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 doo, Baby Shark, doo 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 doo, Baby Shark. And you can see that rate will keep the blood flowing throughout the mannequin the whole time.
That's
But-
very fast.
Yes. That's why you want to, so let's say this person on a table, get up on the table and make sure you're able to lean because it goes really quickly and you want to be able to keep up with that tempo. But yes. And also, yes. Also, I know that in movies or shows, you might see people give mouth-to-mouth resuscitation or give rescue breaths that way. We don't do that anymore. What we as emergency medical responders, first responders use is this BVM, and that's how we give breaths to people. But this is connected to oxygen. Before emergency responders get there, medical responders get there, just continue compressions. You don't need to worry about giving them breath. The compression is the most important part, especially because when we as responders are giving breath, we're giving them more oxygen than needed. We're breathing for them. But when you're just doing a regular rescue breath, there's no way to tell if that breath is actually getting through to their lungs and if that's actually going to help them. So the most important thing is just the chest compression. Okay, and then I'll come back around. And are there any questions?
Entonces, ¿hay cualquier pregunta? ¿Hay cualquier pregunta?
Sí, yo tengo una.
Yes, I have one.
¿Puedo preguntar?
Can I ask?
Okay. Yo tengo a mi mamá.
Okay, I have my mom. She's 84 years old. And
Miedo que un día no respire. Entonces yo compré esto, que es oxígeno. Pero yo no sé qué hacer, o sea,
I don't
solo
know what to do. Like, I just bought it.
de pensar en que ella se me puede morir un día. Entonces, ¿cómo le hago? Si ella,
What do I do if one day she's,
¿puedo dar el oxígeno? Pero ¿cómo se hace?
and if so, how do you do it?
I don't know if we want to translate for the whole group to hear.
If you could just repeat the question, that would be great. Thanks.
Okay. So I hear what you're asking me is, you have your mother's older and you are
Está más grande.
breathing, what to do in that case?
Sí, ya
When she does stop breathing, you still just want to do the chest compressions. That's why the most important part here is calling 911.
در قدم اول میگه شما اگر مادرتان بسیار ضعیف است و میفهمید که او را صدمه میزنه باید به 911 زنگ بزنید.
But after she is not able to breathe and
برای جریان باید قصه شود که ما بعد از او اکسیژن دادیم اما اکسیژن کافی نبوده و این جریانش خوب نشده.
خانم گفت که در قدم اول شما به 911
trying to bring her back to life during that time. We're unable to know why she stops breathing, but if it's because of choking, because older people, they tend to, have trouble with choking, and trouble with chewing and eating. We'll go over choking, how to help people with choking, so choking techniques later on in the presentation. But if she is unable to breathe and she goes unconscious, the most important thing to do is call 911 and continue doing chest compressions until the emergency responders get there. Did that answer your question?
Sí, sí, muchas gracias. Pero otra pregunta.
Yes, thank you so much. But another question, how many compressions?
Otra vez y descanso. ¿Cuántas serían?
So
Either.
you actually don't want to rest. That's why it's really tiring. So proper technique is really important.
C'est vrai que c'est très fatigant.
Question was for other people, how many times should you start doing chest compressions before stopping and resting and then starting again? Usually you hear like people counting, but more research has shown nowadays it's more important to continue as long as possible before emergency responders take over. So that's why having good technique is important. And when more people around you know how to do CPR, you can show them in the moment and allow them to take over as well, or if they already know. So does that answer your question?
Gracias.
Perfect.
Thank you.
And are there any other questions about CPR?
Bueno.
All
Sí.
right.
Hello? Yes. My question is if the same compression that you're doing on someone's chest is like when a person is choking, is that the same situation?
So what you're asking me is, what you're asking me like in this scenario where someone is, out playing? Is it the same situation, or can I get translator help?
Como la persona que está.
Oh no, like the person is eating and choking.
Yes.
Entonces, es la misma compresión que pueden.
Do you use the same compression there on their chest? Like when they're choking on their food, as to when someone just can't breathe?
So her question was, if someone is choking on their food, are the chest compressions we're learning here the same that we want to do for them? And yes, the answer is yes. You definitely want to, these are the best chest compressions. They're universal. When people are choking, that's immediately what we start doing if they fall unconscious. We'll talk about choking more in the last section of this presentation, if that answers your question. We'll talk about it more later.
So Emily, just to clarify, if someone is choking and still conscious, they would use a different technique that we'll talk about later. But if they're choking and then become unconscious, that's when someone would start chest compressions?
Yes.
Okay.
Yes, thank you for the clarification. So you only start chest compressions when someone falls unconscious. So that's how you assess whether or not they are, I guess, viable for chest compressions. That's probably bad wording, but that's when chest compressions are needed, is when they become unconscious. Okay.
Yo tengo una pregunta, perdón.
I have a question, sorry. Emily, for the compressions, the chest compressions.
Antes, solo antes de un año.
Only when they're under a year old. So after 1 year old, is it the same compressions that you would use on an adult?
So her question was for the infants that were less than 1 year old, is after 1 year, do we use the same compressions that we do on adults and children? And the answer is yes. It's just with infants under 1 year old, that you do either the wraparound technique or the 2-finger technique.
Okay.
Okay.
Y es con la misma,
And it's with the same speed as well?
It's with the same, it's with the same rate and speed for all ages. You always want to do it. So you can look up the Baby Shark song if you want to know the rate.
Great. Thanks so much,
Entiendo.
Emily.
Y, por ejemplo, cuando se acaba, por ejemplo,
And for example, like when we finish Baby Shark, how much time do I have to wait? Like a minute or seconds, or do I just keep going?
Okay, so the question is if you should do it for only a specific amount of time or do it continuously. And for children, for all ages, you want to do it continuously. You don't want to stop because you are beating their heart for them. So their heart is always beating all the time when they're alive and healthy. So that's why, yes, you want to continue your compression so that you're beating their heart for them. Yes.
Thank you so much, Emily. I'm watching our time and it's 7 o'clock, so I can put up the slides for the next section. And if people have more questions about CPR, we can come back to them at the end.
Okay, perfect. Sorry about that. Okay.
No hay problema. Muchas gracias. Ya resolvió mi pregunta.
No problem. Thank you. That responds to my question.
Okay, so this section is going to be quicker. CPR has a lot of facets to it. So for bleeding, if we go to the next slide, again with bleeding, the first step is safety. So you have to determine your own safety before trying to stop any bleeding from anyone else. So assess if the scene is safe. You cannot help someone else if you're injured, and make sure to wear gloves if possible. So in scenarios where someone is bleeding, there might be an assailant or there might be dangerous objects around. That's why it's important to make sure that you're safe before helping someone else. And we can go to the next slide. Okay, so if you get blood on yourself, so on your skin, make sure you wash your hands thoroughly with soap and water and notify the medical responders. Okay, the next slide, please. And EMTs, EMS, we love our acronyms and our mnemonics. So here's our ABCs of bleeding. A, you can just remember these when you see someone who's bleeding. So A is alert. Alert, call 911 or have someone else call 911. That is super important because we have the resources to help them and also take them to a hospital where they can be helped even further. B. So B is bleeding. Find the bleeding and remove clothing if necessary. Try to identify life-threatening bleeding. So we can go over that as well. And if someone is wearing dark clothes, like I am, how you can identify bleeding is if you have gloves on, if you just run the back of your hand along the clothing and check your hands to see if there's blood on them, you can see where the bleeding is. And if you identify bleeding and it's underneath clothing, remove the clothing. Okay, and we can go to the next slide now. Okay. So what is life-threatening bleeding? It includes spurting, the blood that's kind of spurting out of the wound, clothing or bandages that are soaked in blood, so the blood has soaked through the clothing. If a person is confused or unconscious, we call that altered mental status in emergency medicine, that is a serious sign and that is life-threatening. And if there's any pooling blood, so any puddles of blood around them coming from them, that is also life-threatening bleeding. Okay, and we use different techniques when there's bleeding in different areas of the body. So when there's bleeding in the arms and legs, we call those extremities. You use direct pressure and then a tourniquet. So direct pressure, sorry, let me get up please. Okay, so with direct pressure, you just need to grab a roll of gauze. Here we go, yes. So we just need to grab a roll of gauze here and, you know, use a little bit of gauze or any bandage, or even if there's nothing around, use use clothing, you know, a jacket, anything, a napkin, and just press down as hard as you can. Like I was talking about with the CPR earlier, you want to lean your body weight on it. You don't want to push down with your actual arm muscles. So if you're able to do so, just lean your weight onto that piece of gauze. And if the bleeding doesn't stop, and if it's serious, there are also things called tourniquets right here. And I will demonstrate how to use them. These can be found in Stop the Bleed kits. Similar to AEDs, you may find them around. At least on the UTD campus, there are Stop the Bleed kits in all buildings, and you should be able to find them in places. So if there is one available, try to obtain it. Yes, Stop the Bleed kit, yes. So how does a tourniquet work? A tourniquet works by stopping the blood flow. So there are major things. This is pretty serious. Let's see here. Okay. And can we go back to the slideshow real quick, Callie? Sorry. If we go to the next slide. So, and then the slide after that. Okay, so with the tourniquet, if there's life-threatening bleeding, and this is only on the arms and legs, do not put a tourniquet on the neck. You want to put it above the wound. So let's say if this was a Stop the Bleed class, I would have makeup and everything. But let's say I'm bleeding here very seriously. You want to put the tourniquet far up along my arm. So as far up as possible, right? But if I'm bleeding, let's say I'm bleeding below my elbow, it might be better just to do a couple inches above and just like above my elbow joint. And if this was in person, we would be able to play around with this. But basically, the only thing you don't want to do is apply it over a joint. So you don't want to put it on my elbow. You don't want to put it on my wrist or on like my shoulder area. You want to put it on the meat, the muscle part. You can place it over clothing. This t-shirt is pretty thin, so you can place it over this thin t-shirt. But if the clothing is too bulky, if it's a jacket, like a puffy jacket, do not place it over that. And how you put it on is it'll come wrapped up. There's a Velcro here. You just take off the Velcro, pull it up here. I'm just going to do it right here so it's easy to see. You can also put a tourniquet on yourself. And you want to pull this as tight as possible. This is going to hurt. The person is going to be in a lot of pain, but this is important to stop their bleeding and save their life. So just let them know it's going to hurt. You pull this as tight as possible. And there's a little Velcro part here that you're going to pull through. And then there's a stick here, and you're going to actually wind the stick. So you're going to wind it like this, and you just keep winding until you stop their blood flow. And then you put it here into the Velcro. Sorry. You put it here in the Velcro, and you just strap it down. And then here's another important thing that you need to remember at this moment. You need to write down the time and the time that you put it on, because later on when they're transported to the hospital, what time they've got this tourniquet put on is going to affect their post-emergency care. Okay, that really hurts.
And Emily, if someone is somewhere that there is no Stop the Bleed kit, is there something that someone can use as a makeshift tourniquet?
Yeah, so we don't necessarily encourage makeshift tourniquets, but an emergency situation is an emergency situation. You can rip up a t-shirt and just tie it as tight as possible to stop that blood flow. As long as you mark the time, you note the time that you put it on, it should be okay. And as long as you don't put it on a joint, but put it above the wound, try to put it as far above the extremity as possible. Or if you can't do that, at least 2 to 3 inches above. So for my leg here, I don't know if you can see, sorry. Let's say I'm bleeding here on my thigh. I want to put it as far above here as possible. So yes. And that's only with serious bleeding on the arms and legs. Okay, and if you see the bleeding is still continuing after you put on the first tourniquet, you can put a second tourniquet right underneath that. Okay, now we're gonna head into torso and junctional area. So the torso and junctional areas, so it's just gonna be your torso here. And then also junctional areas include your sides here, like around your hips, and also right around here, around your neck and shoulder area. And yes. Here, you want to use direct pressure again. If you just press down as hard as possible, lean on that. And you can also do wound packing. I don't have a wound packing demonstration with me right now, but essentially, if there's a hole in someone's, like there's a big chunk of flesh pulled out of someone's body, you want to actually stuff it with gauze, but only in junctional areas. So don't do your chest or abdomen, only on these side parts, like this, my shoulder area, my hips, those areas, my side a bit, not the stomach and the chest. What if the person is bleeding on the head? So that is a serious injury and direct pressure if possible, but that's when emergency medical response is really needed. We just need to get them to the hospital. So direct pressure, do not stuff, do not pack a wound that's in the head. Yes, and the way you do that is you literally just take a bit of gauze and you just keep moving the gauze into the wound as deep as possible. And then you keep going until it goes to the top of the wound. So let's say this is the wound and this is the top. I filled it already. And then after that, you just press down and hold on it. Yes. Okay. That's only for junctional areas. Do not pack the chest and do not pack the abdomen. The chest and your stomach, it's an empty hole. There's just organs there. You're going to probably damage some organs if you pack it. Yes, so there's no end. You're gonna keep going and keep going, and next thing you know, there's no gauze left and they're still bleeding. Yes. And then chest and abdomen is the last third one. And this cannot be stopped outside the hospital, even with direct pressure. What we do is when EMS gets there, we have really large seats and we have stickers that we use, but the bleeding can't be stopped. So they just need to be transported to the hospital and go into emergency surgery. So the number one thing you can do again is alert 911. Yes. And I think we can go to the end of this section. I think I demonstrated everything, so I can take any questions for this section here. Yes, you can see the wound packing there. Yeah, they're just moving the gauze into the wound. Are there any questions in this section? Usually we do like a whole stop the bleed course where everyone has hands-on practice, but it's really hard to simulate over Zoom, so I'm sorry about that.
ما همه چیزا درباره کمک‌های اولیه و خونریزی دانستیم. اما چه مشکل است در یک ساعت یا نیم ساعتی از این چیزها بیاموزیم من بازم
What happens if we tight the tourniquet too tight?
I'm sorry. Someone, what was that question again?
I think the question was,
what happens? What happens if we wind the tourniquet a little too tight or if we don't wind it up enough?
Is there a translation on that? I'm sorry, I don't know the word.
Sorry, Emily. If you're are you in the English channel for interpretation?
Yes.
Oh, okay.
Or yes. So, should I? Oh, I'm not in. I'm just in original audio.
Okay.
Sorry.
Can you change to English and then
Yes.
you can hear the interpretation?
Okay.
Thanks.
I'm so sorry.
No worries. But the question is, what happens if the tourniquet is wound too tight?
Okay, wound too tight. The tourniquet can't be wound too tight. It's just gonna stop the blood flow. So as soon as you stop the blood flow, that's perfect. If it's wound too loose, you just have to do another one under it or above it, because the goal of the tourniquet is to stop the bleeding. That's why it's really important that it goes on, because if it's on for too long, like particularly more than 3 to 4, sometimes 7 to 8 hours, that can have serious implications for the person's care and the fate of that person's extremity. But, you know, it's important because it's better that maybe they suffer a little damage to their arm, but you can save their life because they don't bleed out. Okay. And are there any other questions, or can we move to choking?
Bueno.
Yes, hello?
Mi pregunta es,
yes, my question is, whenever on your arm, when you have the injury and you have to put the tourniquet that you were talking about, is it on the injury? In reference to the injury?
Okay. So you always want to put the tourniquet above the injury, closer to your body. So you're only using tourniquets when there's an injury on arms and legs. So if it's an injury on my leg, I always want above my body, so closer to my hips. And if there's any injury on my arm, I want to put the tourniquet closer to my shoulders here, if that makes sense.
No, sí, pero
yes, but is it on the injury or is it to the side of the injury?
You never want to put it on the injury. You always want to put it to the side, but closer to the body, so closer to your main torso. Okay. And are there any other questions before we move on to choking? Okay, perfect. So this is our last section, and I also know that we had a lot of questions about it. So if we can go to the next slide. So when it comes to choking, there are a couple of different techniques that we can use. If you see on the left, the very left picture, that's the Heimlich maneuver. You might have seen this before in TV shows or movies. And basically, this is when you make a fist with one hand and close the other hand, and you push inward and upward into the stomach. I'll demonstrate that in just a moment. If they are pregnant, so you see on that middle photo right there, if they're pregnant, you want to do it on their chest and not their stomach. So the first picture, you can see he's doing it on her stomach. Second picture, he's doing it on her chest. And then for children or infants, you want to do 5 back blows and 5 chest compressions. So I will demonstrate that in just a moment. And most importantly, if they go unconscious, so they faint and they're non-responsive anymore, you can't feel a pulse anymore, start CPR right away. Okay. So if we go to the next slide, when do we use the Heimlich maneuver? So the universal sign of choking is hands to the throat. Everyone, when they're choking, it doesn't matter what culture, what language you speak. If you're not able to speak and you're choking, your hands are going to go to your throat. So if their hands are to their throat, that's a sign that they're choking. If they cannot talk and make a sound, so let's say they're choking and they're trying to speak or they're trying to say something, but they can't do it, that also indicates that they're choking. They're having difficulty breathing. You can hear them really struggle.
بسیار زیاد مشکل است که
respiratoire, c'est les mains deviennent.
Que su piel se está poniendo más azul. Ese es otro signo.
Heimlich, when they are just coughing forcefully. If they're coughing, there's still air coming out. They're still able to breathe. You want to encourage them to keep coughing because coughing is their body's natural way of trying to expel whatever is stuck in their throat. So you know when they're coughing really forcefully that it's okay, that let them sort it out and be prepared just in case, but try to let them sort it out. Okay, so we're going to demonstration portion right now. I'm going to start with the infant. So I have the infant here again. And when I say 5 back blows, 5 chest compressions, basically what you want to do is you want to hold the child. You want to hold the child back like this, and you want to do 5 back blows. So 1, 2, 3, 4, 5. You want to do that with this part of your hand right here. So 1, 2, 3, 4, 5. Then you use the same hand, hold the back of their head, flip them over, okay? And then you do 5 chest compressions. So the 2 fingers here, 1, 2, 3, 4, 5. Okay, then you want to turn them back around and keep doing it. 1, 2, 3, 4, 5. And you kind of want to push like that down like that. And then you flip them back over. 1, 2, 3, 4, 5. Another thing you want to do is when you flip them over and do the 1, 2, 3, 4, 5 chest compression, you want to look into their mouth to see, is there anything in there? Is there anything I can take out? So If you see anything, try to scoop it out. All right, so that's what you do for the infants until, they stop choking or they go unconscious, and that's when you start your chest compressions completely. So your baby starts do, that's when you start it. If they just go completely unconscious. For an adult, I actually have a demonstration here. We have a little vest here. Let me just set this up. Okay, so for an adult, this is his stomach. You want to use your fist and do it outward. So don't do your fist like this, but face it like this. And you want to cover your fist with your other hand. And you want to push upward like that. So you want to push like this. You want to push in and up, in and up. So you want to keep doing that forcefully until, you want to keep going up forcefully like that until it is dislodged. Let's see here. I don't think that this is going to be dislodged, but that is the demonstration basically. That's the Heimlich maneuver. You can also, if you yourself are choking, you can also perform the Heimlich maneuver on yourself if there's no one around to help you. Let me swing around. So you can see this portion of your stomach. If you go to a table or a chair, you can push against the table or the chair inward and upward. So inward and upward to do it on yourself. Okay. Okay. And that was the choking demonstration. So I think those were all three of the sections. And if there's any questions on any of the sections and on choking right now, we can go over that.
Emily, you said that you do the Heimlich maneuver if someone is choking until they go unconscious, and then you would do chest compressions of CPR like we learned at the beginning. How do you know if someone goes unconscious?
You can tell if someone goes unconscious when some signs is if they go limp. If you feel them relax, their muscles are relaxed, they're just heavy. It's like seeing someone faint almost too. If they're not able to stand up and support themselves, if you can't feel a pulse on their neck, so it's going to be on the side of their neck, so you can just put your hand there and lightly feel for that pulse. If you can't feel a pulse, that's also a sign that they've gone unconscious. And if they're turning blue and they're limp, they're not responding to you, they're no longer, holding their throat, you don't hear anything anymore, like you don't hear them struggle, those are all signs. That's how you know that they've gone unconscious and unresponsive. Okay, and are there any other questions?
Sí, mi pregunta es cuando el bebé
Yes, my question is when a baby or an infant, when you're doing the chest compressions and on the back, which one is first? And like, is it better to start on the back or on the chest? Which one's the first step?
Yeah, that's a great question. So we start out with back blows. So it's better to start out with the back blows and then you turn them around, do your chest compressions and look to see if you can find anything in their mouth.
Okay, gracias.
Okay, thank you.
Emily, you said that to tell if someone's unconscious, one of the things you should look for is a pulse. If someone has a pulse, so you can feel their heart beating, should you do CPR? Should you do chest compressions?
So that's an interesting question. Typically, for adults, we don't start CPR unless we can't palpate a pulse. Palpate just means feel for it. And it's specifically feel for a pulse, a brachial pulse. What that means is one of their main arteries. So you might see people take heart rates at their wrist. That's sorry, I am losing the word. It's a peripheral pulse, if that makes sense. So we usually don't feel it. We usually don't start chest compressions until there is no pulse. We're just prepared to. However, with infants and children, we usually start CPR if their heart rate is below 50 BPM. So I don't know why we don't start it right away for adults either, but if an infant goes unconscious or a child goes unconscious, just start CPR if they're not responsive and you know that they were just choking and then they go limp and they're no longer struggling, they're not breathing well, just start CPR. Don't try to feel for the pulse. Children particularly decline quickly when it comes to respiratory issues. So it's really important to be quick, be fast, and be aggressive when it comes to treating children with respiratory issues. So you can continue the Heimlich maneuver on adults until they go unconscious. It might be hard to feel a pulse. You can start CPR, but typically we don't start CPR on adults until after there is no pulse.
Emily, so you said that for adults, you should check the pulse. I can't remember the word, but like in a primary place. So where are the places you would do that?
I would focus primarily on the neck. There's a artery that goes through the neck here. You can also check that in the thigh, I believe. But it's easier to do on the neck and it's more accessible. There's usually not clothing there that's preventing you from feeling the pulse. Also, a quick note, when you are trying to feel for a pulse, don't press down too hard. Because you can just cut off that artery for that moment and you won't feel anything. Also, don't use your thumb because your thumb has a pulse in it. So you might be feeling your own pulse. Okay. And are there any other questions regarding choking or bleeding or CPR?
Sí. Disculpe.
Yes, excuse me. Did you say that we should do the back blows and then try to take out an object? How do I know when it's a good moment to take it out and not have a risk of maybe pushing it in deeper?
Yeah, so in that scenario, it is difficult. That's why as EMTs, we do get trained on actual maneuvers we use to get rid of things. But you can try not to put your finger into their mouth unless you actually see something that you can kind of sweep out of there. In that scenario, just try to try to get it out or see if it can come out as you're doing your back blows. But usually if they're not unconscious yet, they're still just choking, like they're still struggling. It's okay, like it's not necessarily a bad thing to stop compressions because they're not unconscious yet. You're not beating their heart for them. So you can stop if you see it, and feel free if it's easy and you don't feel like there's a risk of pushing it in deeper, to kind of sweep that out gently of their mouth. Does that answer your question, ma'am?
Sí, gracias.
And I would also encourage all of you, if you are interested, we do CPR and Stop the Bleed courses. Other places also do it, like community places do it. If you're interested in getting a more in-depth and in-person training, and you can get certified for both CPR and Stop the Bleed. So, yes.
Okay, if there are no more questions, thank you so much, Emily, for that presentation. It was very enlightening. Thank you for coming, everyone. We're going to send out a copy of the slides and any other resources after the presentation. If you're interested in joining us for a session on nutrition in July, Carly is going to post the link up in the chat. And also, if you did not attend our mental health session, Carly is also going to post the link up in the chat so you can have some resources there for you. If you have any further questions for us, you can always send us a message. We have a WhatsApp group. Carly will also post the link up for anyone who wants to join our HRI Connect WhatsApp group. Otherwise, if you want to join us, you can send me or Carly a message. Thank you so much for coming for this session, and have a great night.